Thank you for joining us. This is session one of a new learning collaborative series supporting youth and foster experience in the crisis care continuum. So this training is offered through the Crisis and Recovery Enhancement TA Center, which is funded by the California Department of Healthcare Services and administered by the Center for Applied Research Solutions. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the California Department of Healthcare Services. In the event of security issue, the session will close immediately and will not resume. We'll send you a separate email in case with any further instructions. So thank you all for being here. So what is CARE? The Crisis and Recovery Enhancement TA Center provides a comprehensive array of training and technical assistance services to the Mental Health Services Act funded stakeholders and partners with the purpose of strategically planning, implementing, and evaluating their behavioral health coordination and crisis response efforts. Our TA Center is a collaborative of experienced partners for a collectively well-rounded knowledge base of the crisis continuum. So this includes CARS, the Center for Applied Research Solutions, RI International, NAMI California, C4 Innovations, Impact Justice, and of course our host today, Stanford Sierra Youth and Families. As noted before, we offer a comprehensive array of training and technical assistance, and this includes listening sessions, our resource library, quarterly newsletters, and content digests, among many other offerings. And that brings us to today's session, talking about how to support youth with foster experience and the crisis care continuum. So thank you for being here, and I will pass the mic over to our colleague at Stanford Sierra Youth and Families.
Thank you so much, Ayana, and we are so grateful to be here and so grateful you all have joined us. We know that there are many ways you could spend your Monday morning or afternoon, depending on what time zone you're in. I see people joining from lots of different areas, so thank you all for providing that information in the chat. But we're appreciative that you're joining us this Monday to talk about such an important need in the community, which is foster youth that are experiencing crisis and exploring ways through this learning series of how we can best elevate community voice, those that have been impacted, and put together plans to really comprehensively approach this in a way that involves our community, our youth, and also explore the components of how to make sure we're doing that through an equity lens. So again, we appreciate this opportunity to be here. My name is Ebony Chambers. I am one of the presenters today. I'm the Chief Family and Youth Partnership Officer at Stanford Sierra Youth and Families. We have other presenters here. I'm going to allow them to share themselves, introduce themselves, and then we also have some panelists that we're excited to also introduce as well. So we'll do that now. I'll pass it over to Gibran.
Hello, everyone. My name is Gibran Mendez, and I'm the Director of Quality Improvement at Stanford Sierra Youth and Families. So nice to see you all here, and welcome.
And Tamisha?
Good morning, everyone. My name is Tamisha Wallace, Youth Advocate Manager at Stanford Sierra Youth and Families, and I have the privilege of facilitating a very short dialogue today with some peer mentors from the agency about their experience in navigating the foster care system.
Good morning. My name is Sydney Weiss. I'm the Empowerment Training Coordinator at Stanford Sierra Youth and Families, and I'm happy to be here with you all today.
Awesome, and we'll introduce Shelby and Kayla, and then Sydney will also be on the panel as well today. And so we'll introduce them in just a moment. But just want to quickly go over our agenda for our time together. So welcome. We're going to share just a little bit about our organization and what we do, and what's so great is being able to have this learning series to be able to build on. So we hope to unfold more and build on what we're learning and what we're taking away from today. But today we'll do just some very brief introductions about us. We'll talk about the why, but really the panelists will really talk about the why. They have the experience, they have lived experience from navigating different systems in crisis, particularly foster foster care and mental health. And so we want to make sure their voices first are elevated, because we know, and we have a saying, nothing about us without us, and that we cannot look at transforming systems without truly embracing the voices of those that have been impacted by them and are navigating them or have navigated them. And so we're really appreciative and grateful that our panelists are here and willing to share their experiences, and that we can learn from those voices and really support us in moving forward and shaping and designing systems that are truly built with the voices in mind. And so we'll have an opportunity to hear from the why directly from our panelists. And then we'll talk about what does assessment and exploration look like. We'll have a breakout group. We'll have breakout groups. We'll be able to unpack what we heard in the panel, and then some direct questions that you'll have to answer to explore what are the next steps. What can you do within your own organizations or within your own counties? And then we'll be introducing the Plan, Do, Study, Act, the how, which is what Bron will be introducing this tool, and you'll have to take away with you and to put into practice between now and the next series. So a little bit about Stanford Sierra Youth and Families. Our mission, we are a youth and family serving organization, serving youth across the vast continuum of care, specifically in child welfare, mental health, and also youth that are impacted by juvenile justice systems as well. Our mission is to transform lives by nurturing permanent connections and empowering families to solve challenges together so that every child can thrive. And then our vision is that communities have safe, lifelong connections for all young people that are built and strengthened through generations of empowered families. And that generations of empowered families really speaks to me, because I just believe that there's an opportunity that all of us have that are here, that decided to join today, to really make a change for generations to come, to shift and move the needle in regards to how we're approaching crisis care, and seeing that through that shift, that the long-term result is that efficacy lasts not just within the unit we're serving, but that it shifts for generations to come, that families have the connections, they're supported, and they're safe. So our organization, we have the Family and Youth Partnership Team, which all of our presenters and our panelists are all a part of, including Bron as our honorary member, although he's a part of Quality Improvement and Research, definitely in close partnership with our Family and Youth Partnership Team. We all have lived experience that have navigated a system of care, whether that's child welfare, juvenile justice, or mental health systems. So myself as a parent, navigated that system along with my child, but as an adult, I've also navigated the mental health system and openly share those experiences with our organization and with the community to help ensure that my voice is included as I've been impacted by those systems. And so our parent partners, our family partners are those that are parents that navigated on behalf of their children. And then we also have younger adults who also had direct experience as youth. And they have navigated that system either as young adults themselves or when they were in care, either juvenile justice, child welfare, or just navigating the system as a young person through the mental health services. And so they are partners with clinical teams, with foster care social workers, with juvenile justice practitioners, really working as a part of the interdisciplinary team to ensure that youth and family voice is elevated, that youth and families are partners, if not leaders, in service delivery, that their cultural and linguistic needs are also being addressed within that system of care, so they also serve as cultural brokers. They are also a part of the interviewing and hiring for all new staff within the organization. And they are also trainers. So they train all of our team, any of our staff. We serve about a little over 5,000 families in the greater Northern California area. And our staff is about almost 300. Every staff that comes in is trained and interviewed by someone from our Family and Youth Partnership team. So we're embedded in all of the programs that serve the community and ensure that our voice is also as a part of leadership team. So we're working collaboratively and meeting weekly with the executive leadership through the specific program leadership meetings, but also providing feedback and coaching, mentoring, and support to staff related to ensuring that family voice and choice is truly honored. And so you see down below the nothing about us without us, and that just ensures that in every aspect of our organization, Family and Youth Partnership is truly embraced and integrated into our system. Into our systems and practices. And so with that, I'm excited to turn over the mic to Ms. Tamisha Wallace, who will be facilitating our panel today.
Thank you, Ebony. I appreciate the overview. I do want to make a quick correction. Jalen unfortunately had an emergency and is unable to be with us today. So Sydney Bice is going to step in his place. So thank you, Sydney, for that. So Sydney, who is the coordinator for our Families Partnership team today, comes with experience in navigating the mental health and foster care system, as well as Ms. Shelby Boyer and Kayla Radacki. So we appreciate you all for being here. One, in utilizing your voice and your experience to help inform how we move forward as a system. We appreciate that. And also for the amazing work that you do in utilizing your experience to support and empower families and moving forward in their own services. So welcome and thank you. So I'll get us started with our first question. How were you made aware of crisis and preventative services in your community? Shelby, can you get us started?
Hi, everybody. My name is Shelby, and I'm a Wonder Program Specialist with Stanford Sierra Youth and Families. I was made aware of preventative services through one of the staff members at the local group home / shelter that I stayed at. And she went above and beyond to make sure that I was aware of the services in my community. So much so that she actually went on to be my mentor. And much like Stanford Sierra, I feel like it's super important to have that lived experience because those seem to be the staff members that can relate on different levels. So I'm grateful to her for sharing that information with me so I could be successful. Thank you.
Absolutely. And thank you for sharing that experience with us. Sydney, I'm not sure if you have a response for that question.
I can add. So in short, I wasn't made aware of any services as a youth. My school was great about doing short presentations and assemblies on things like suicide awareness and like job readiness and college stuff, but was very, didn't take that initiative to really provide any resources on what to do with that information or how to get connected. And it wasn't until I was in my early adulthood where I would get connected to mental health services, and also wasn't until I was to a point where I was in the hospital for suicide attempts. So it felt like a very fail up system. And I feel like there was many missed opportunities to provide those resources to me as a teenager while I was in high school, and providing some sort of way that I could have known that there was different supports out there. Because in my head, I was like, wow, I'm the only one going through this and there's no one out there to help me. So I feel like that's one way that it could have been improved for sure is, having access to kiddos in high school and even younger, just to share with kids, because kids are there for most of their week, 8 hours of the week, 5 days a week. And that I feel like that's a perfect opportunity to reach them if they're feeling like they need additional support. But I didn't have access to any of those things until I was an adult.
Absolutely, Sydney. I agree with you 100%. I think oftentimes we receive information once it's too late, right? So I agree that having information beforehand can be helpful in preventative measures. So thank you for sharing that. Our next question is, please describe a time when your voice and choice was not honored. What could service providers have done differently during this moment to make your voice heard? Kayla, do you want to get us started with that question?
Yeah, so for me, I feel like it was a kind of a continual thing of my voice and choice not being honored because much like Sydney was answering for the first question, I really wasn't made aware of services. They weren't offered to me. So I think that something service providers could have done differently was just to help make me more aware of the services that I should have had and the ways that I could have been using my voice and choice because I didn't know like that certain decisions weren't supposed to be being made like without checking in with me, especially when you're over like a certain age. You know, they're supposed to be like asking for your input and this wasn't happening and I didn't know that it was supposed to be happening, so I never got the opportunity to use my voice and choice.
Thank you for sharing, Kayla. Shelby?
Um, Definitely, much like Kayla was saying, it took, for the first question, I was able to answer it because I did get that support, but it did take time. It took multiple attempts. I had a reoccurring crisis that when law enforcement would come out, I felt that they treated me as if I was the boy who cried wolf or just a statistic of like just a teenager, and they went along with what my caregivers were saying. And I definitely feel like they could have had more empathy for my situation instead of being biased and siding with my caregivers.
Thank you both. Sydney, Bryce, any follow-up there?
Yeah, similar to what Shelby was saying, my voice and choice not being honored wasn't necessarily with the therapists or therapy services I received. It was the point people up until that that connected me to them. So the EMTs who would take me to the hospital because I was being placed on a 5150 hold, and law enforcement that would come to my home. Very poor way of communicating with somebody who is having suicidal ideation and telling me that I need to be on medication when I'm not prescribed medication and because I didn't need it at the time, and just inserting opinions and things that weren't needed at the moment. They didn't provide support in the way that they were supposed to while being there. They had a lot of unhelpful things to share with me along the car ride over to the hospital, as well as feeling a lot of that judgment from them. And it didn't make me feel any better. And it made me feel like, oh, there's people in this ER right now who are dying of like physical injuries. And here I am with my like mental health stuff. Like, and that's how they made me feel because of those conversations before we got there. Yeah.
Thank you for sharing that so transparently, Sydney. I think something that's very necessary in those moments is a trauma-informed or trauma-sensitive approach to help de-escalate. And I think when the opposite happens, it actually further escalates the situation. So I appreciate that point. And I think it leads us naturally into the next question of speaking to an experience where empathy wasn't present when you're in the midst of a crisis, and how your service providers responded to you in that moment, or what could they have done differently if empathy was not present. And Sydney, you started to share, but I'm wondering if Shelby, if you can get us started with that question.
Absolutely. I think the effective collaboration during my particular crisis would have been having unison between the involved parties, such as the law enforcement who came out to the scene, and then the social workers at the group home. And instead of making me feel like I was just, making it up, or it wasn't a real thing when it was occurring multiple, I feel like if there was more follow through, or if there was some way that they could like, okay, I've been out to this house for the same issue 5 times. Maybe this girl isn't making this up if it's a continuing thing, or like, I know that there is systems in place, but I just feel like it's definitely a matter of following through to ensure the safety and well-being of the community members.
Thank you. Sydney, what about you? For Shelby mentioned a great point. What could have supported her in that moment is effective collaboration between system partners. How do you think that could be improved?
Well, I think with that situation that I had described earlier, specifically speaking on that, just listening to me and being that empathetic ear, and all the judgment and biases that you have really aren't needed. We all come through our different backgrounds, and they came into my home with one judgment of the kind of person I was without knowing the full story or my entire background. And you don't need all of that to be an empathetic person and to just listen to what someone's going through. And I feel like I didn't get that full experience of someone really hearing what I was going through until I was admitted into the hospital. And everyone at the hospital was amazing. Really just let me have that space to really process what I was going through. And by the time I left, I felt so much better. I was like, wow, finally, I'm being listened to and I'm being heard, and I know what my next steps are because I'm not being given the runaround, and I'm not being made like I feel being made out to be like this horrible person who is just wanting to hurt other people and is being selfish. It's really makes an impact on someone when you take the time to really slow down and hear what their needs are, and really leaving your judgments at the door. And that made a huge difference in that one particular experience, and would have helped me a lot sooner if that had been my initial exposure.
I think that really speaks to the power of just listening and honoring that voice and choice, and what that could do to make someone feel comfortable in that moment and safe. I think moving forward with developing trust with service providers, right, to hold you while you're in that very vulnerable space. So I appreciate you sharing that. I'm wondering, Sydney, with the wisdom that you just gave us, is there any other final thoughts or recommendations that you all will offer, whether it's what could be done as a system to prevent crisis from occurring with youth, or once we're in the midst of in those moments, what could service providers do to better support youth in the moment? I hear active listening and just holding space for them and honoring their voice. But is there any other recommendations that you all would offer?
Yeah, my suggestion and recommendation would be when kids are telling you that they are having feelings and needs, it doesn't matter the age, hear what they're saying and take that seriously, and don't brush it off as, oh, they're just being dramatic or they're just being a teenager, or that doesn't matter. Because when you're a teen experiencing those things, or at least for myself, I definitely felt that. I was definitely brushed off a lot as just being an overly emotional teenager who didn't need anything, was just kind of sent in a room to pray away whatever is going on with myself in the moment, and not really anyone taking, or no adults taking the time around me to really slow down and see okay, what are you needing? There's a lot going on under all of the layers that you're seeing, when you're looking at a kiddo, and just really taking the time to peel that back, and encouraging other adults to peel that back as well.
Thank you, Sydney. Kayla, I'm wondering if you have any thoughts.
Yeah, I think just active listening. And I know in my experience, I think because I didn't present my feelings outwardly, I wasn't one to try to tell people that I was upset, and all of my pain was very inward. I feel like a lot of my service providers kind of saw me as an easy case, and so they didn't ask the questions to really figure out what was going on, and I wasn't just going to offer that information up. So I think just taking the time to just really sit with people and show them that you want to know what they're going through, and ask those questions and offer up that space, because I think I would have talked if I had felt like somebody would have listened.
It's a powerful point, Kayla. Thank you for sharing. Shelby?
I guess my recommendation would be that choosing people to be in these positions to help people with experience, much like Stanford hires with that lived experience, it just goes so much farther, because as somebody who works in the field, I know that personally I'm going to go above and beyond to provide that service. And so I know that not everybody can do that, but it's definitely a super helpful tool to have when you are looking for employees or people to be in these positions.
Another very powerful point, Shelby. As someone with lived experience navigating the mental health system myself, it took for me to sit with someone whose background reflected some of mine and whose culture and ethnicity reflected mine for me to feel comfortable in sharing some of those deep and painful experiences. And I think there's a special connection and ability that folks with lived experience can offer. So that would be my recommendation, is as you're responding to youth in crisis, and in every opportunity where a peer mentor could be connected with the youth in that moment to help de-escalate, I would also recommend that as well, because it really helps for someone to feel safe and able to explain what's going on with them in those moments. So I truly appreciate you all for sharing your voice and your experience today, because I think it truly does inform how we move forward and things that we need to be mindful and considerate of. So I appreciate you all. And I am going to pass it back to Ms. Ebony Chambers. Thank you.
Thank you. Thank you so much to Sydney, Shelby, and Kayla. And just want to take a moment to open the, if there's anyone from that's participating that has a question that they'd like to ask to our panelists as well. Just want to hold space for that. There were some powerful insights, and I appreciate Ileana sharing in the chat kind of some of what was reflected back out around how important it is and how important that power of listening is to increase engagement, but to also ensure that those that are engaged in services truly feel heard, and that they, by being heard, lends itself and opens itself more to participating and engaging in services. There's just so much power there, and from my own experience can definitely share that. And there was a couple of other areas around making sure that youth and families are aware of their rights, aware of how services are unfolding and what their part to play is, what the service provider's part to play is, so that they can be actively engaged in that. But that knowledge is so powerful. And you'll see, thank you, Nina, sharing. Thank you all for sharing that there are some key areas for partnership and co-production. So when we're talking about informing and shifting how we're addressing crisis services for youth and families, there are some key components that we need to really take a look at and explore further, but they're really related to what does assessment look like? What does partnership look like? How do we plan effectively, including voices, including those that have been impacted or navigating the services? What is implementation and access? And I think some of that really was elevated in the panel, just in regards to what is partnership. Partnership looks like listening, listening and making sure that we're co-producing crisis response plans with those that are navigating those systems in mind. So that's another part of it. When we're thinking about access, there is something about awareness. When we have, there's currently a number of initiatives across the state of California that address crisis, one of them being the Family Urgent Response System. But we have continued to find that for those that are impacted or navigating the foster care systems or are resource parents or biological family members, that there is a lack of awareness of some of those services to our communities. And so that goes to access, and also really closely connected to equity, that if our families do not are not aware of the resources that are available to them within their counties, within their communities, that we're missing a key area of partnership. We can't partner if there's a lack of awareness and visibility of the programs and the resources that are available. Is how are youth and families made aware of crisis prevention and intervention supports that are currently available in your county or community? So what does the awareness look like? Are they, is there billboards? Is there, is there flyers that go out, QR codes? Is there social media? Just kind of open that discussion around how are families made aware. If I was just, just entering into services and supports, how will I ensure that I know that the vast array of services and supports that are available to me, and how do I know how to access them? Another question, how are you incorporating youth and family voice currently into your crisis planning? So as I'm so grateful when you joined, if you were able to put your role, and I see we've got some mobile response teams from Napa County. We also have prevention early intervention teams. So lots of different ways, looks like mental health clinicians, SUD counselors. So thank you all for being here, youth crisis coordinator. So lots of different roles that are here and joining us today. And so how are you currently incorporating youth and family voice into your crisis planning? What does that look like now? What resources do you need to explore? What do you think you might need to continue this dialogue? And we're going to have some tools that we're excited to introduce to you to continue this and further this dialogue for our next part of the series after our breakout groups. What trainings do you need? And then what stakeholders do you need to involve? So as you're thinking about developing a response system, a crisis response system for foster youth and families that is comprehensive, that embraces and engages youth and family voice. For the first question related to how are youth and families made aware of crisis intervention and supports, Randy shared that his school has QR codes that they use that are on the walls in areas for youth to be able to access them. It really helps to break the stigma of accessing services because they can do it on their phones, their smartphones, at their fingertips. And then they're also able to see how many youth are actually clicking and looking through those resources. So I thought that was really a great way to do it. Some other teams talked about mass mailings, billboards, bus stops as well. And then just having the conversation and the dialogue. Mariah, our youth advocate, shared it was really important to have the right language and be able to connect with the youth so that you can share what resources are available to them. So building the connection through the lived experience was another way that we also talked about. And then just really quickly, it was another thing that came up was really making sure that we were not operating in silos and sharing communication and so that families and youth had access to the resources.
That just taking away the stigma of mental help, just knowing that it's okay not to be okay, and having those kind of slogans on campus, but also pivoting from the mental, we have wellness centers at some of the high schools I work with, and knowing that it's not just for kids who need mental help. I'm depressed, I'm despondent, because everybody sees this trail of kids going, said, oh, those are those sad kids, let's not go there. When it could be about mental wellness, mental fitness, peak performance right before exams. We can practice mindfulness, we can do yoga sessions. We can turn Saturday school into Saturday academies and hey, let's teach you how to be mindful, how to be empathetic, how to become active listeners, and having youth groups that are being part of these solution on campus so they know that they're hearing from their peers that this is okay. And the hard part is, is learning to be empathetic learning to silence your mind and learning that the words will come. Just being active listeners. You'll have the right words, trust me.
Is one of the things, as we talked about how to elevate the voices of youth and family members or peers who serve in that role, is the burden that sometimes falls on those individuals being the end all and only person to provide feedback, and how it can be hard to kind of say, you know, you get the feedback and then you tell us what to do, instead of them being a highlighted voice to say, and we all partner on that need together as a team, as a clinical team, as a leadership team. I bring and I share voices, but it is not my responsibility to create that change all by myself and be the representative back. But again, that piece of elevating the voices that we're supporting in the moment and elevating them in these positions where they give feedback and being thought partners instead of the people doing all the work, I think was a really highlighted theme. And as a team, we also discuss and brainstorm different ways to create spaces like that. Are there committees where other advocates all join together to share these ideas and they get represented back together? So we shared an example that exists in Sacramento County, and we talked about, are there different ways to make sure that they also have connection with each other to say, what are we all as a team seeing as a common theme to kind of elevate that message to systems of care, crisis support. So I think that was a really great conversation too that we were having in there as we were looking up thoughts and resources and that to kind of highlight for the team.
We talked about a lot of things. So I want to say shout out to Maria. I know you shared a lot about what you do and how you cover the Bill of Rights for foster youth in the beginning. And we talked about how we recheck in on that and offer space. But we kind of got off a little tangent, still keeping some of the questions in mind, but really thinking about from the beginning all the way to the end, how does it look and feel when a foster youth walks up to the organization? Is it an organization or a safe space? Like, what messages are we sending from the beginning? If we're talking about intervening in crisis, are we thinking about bigger picture? So really encouraging folks in our group to think about like how is every effort, every point of contact really speaking to our youth and our families who are being served. We also talked about how sometimes, specifically for our foster youth, there are a lot of system crossing and the barriers in which those crossings make it difficult for people to communicate openly. So, you got to have an ROI for this, and then you got to double check with this, and then this person might have rights to say something, this person might not. And so just acknowledging that sometimes with all of the crossing that our kids who are literally in the center pay for that. And so how do we collaborate and make changes and advocate for something else to happen so that kids don't get lost in the system's crossing?
So we had a really great time to do robust brainstorming, discussions, a review of amazing ideas as a team. And so now we're going to talk a little bit more about the Plan, Do, Study, Act. This is what I'm calling your call to action. So when we go to these great trainings, these great webinars, these great conversations and learning collaboratives, we get inspired by all these great ideas. And then from there, if we don't do anything about it, it kind of sits in this land of ideas. And I don't know about you, I am very action oriented. I get this from Ebony. Ebony's like, go, go, go. And so as a team, just do it. We're gonna learn some practices into how to just do it. And some of you already started that in your conversations as a team. So we're gonna introduce this quality improvement tool in helping you kind of test your change and create that change process within your systems of care and organizations. So let's go and talk about what a PDSA is. So a PDSA is a 4-stage problem-solving model, and it's really a practice and a process to help you look at how to make improvements within your system of care. Personally, I do PDSAs in my personal life. Again, I'm a quality improvement nerd, so I love doing this to kind of say, what did I learn from this experience, and what am I going to do differently? PDSAs don't have to be a very long, drawn-out process. Sometimes, depending on what we're trying to solve and explore, they can take multifaceted steps. But really, it's a tool in the end to us to connect action into learning, and how do we kind of do something better. So we have several different questions that come up in our PDSA, such as what are you trying to accomplish? How will we know that a change has occurred and that there's improvement? And if improvement doesn't occur, what do we learn from that opportunity, from those results? What are we going to do next moving forward? And you already have a set of several questions that will help guide you through this process. You might say, I've never done a PDSA. I don't know what it is. I don't know how to use it. Beautiful. If you can look at these questions and go into a breakout room, you already started part of that PDSA process. It's that brainstorming section. And you're going to have these questions to kind of fill in, what do I know? And if you don't know an answer yet, the best part is that's what the PDSA says is before you proceed, figure out an answer. And so that might mean I might have to collect some more data, or I might have to collect some more information. I might have to explore different things that I've never explored before. Some of the team members in our discussion today said, I didn't even think about that. I hadn't explored that process for our team. I didn't know how to engage youth and family voices before. I heard somebody's idea. That might be your first PDSA, which is let me start and say, how do I start engaging youth and families into our process, into giving us feedback? Today, we had a panel. And we learned how well the panel did a great job of providing us insight and experiences of individuals who have lived kind of navigating crisis and the challenges that they've had. That is an option for you as an agency to take back is how do I recreate a panel within our organization to gather feedback, to gather information, to help us clearly understand what the actual problem and need might be coming up for our community, rather than from some information that you might have had from your staff. You might explore how did we ensure that we had family and youth voices as part of that problem solving or identifying an area of need. So some considerations that are helpful as you do a PDSA, it's helpful to identify some team members to be part of a committee or a work group to help support evaluating the needs and monitoring the change. It's really hard to do a PDSA when you are the only one kind of facilitating that process. So recruit individuals. Create that unified mission that your team is working on when you're looking at the change that is coming up in your PDSA, and recruit individuals from different perspectives. They don't have to solve the problem. They just need to be a thought partner. And you're really recruiting thought partners to be able to help explore different perspectives and ensure you have enough information to start monitoring what happened when we started creating a change aspect or we started bringing in more information and voices from others. So each of the sections of the plan, the do, the study, and the act will have a set of separate questions to kind of guide you as you navigate through that process. The benefit of the PDSA is that it's cyclical. So you don't just do one PDSA and then you're done. It may work out that way. You may do one PDSA and you might realize that, when doing this, we found out that there's a whole need that we never explored before because we hadn't really talked to youth and families from their experience. Now we need to kind of do another check-in with staff and families to say this opened up another door for us to explore more. That's the best part about this learning tool, right? Every time you do a PDSA, you learn more, you have more thoughtful change that occurs over time, and through more information, more data, and more knowledge, you're able to create these sustainable gains and goals overall. So again, one PDSA finding, oh no, we never looked at this. This is the real issue we've uncovered. That's great. It helped you better understand that issue. And now you've created a new set of questions to move forward. So I call this PDSA 2.0. Now that you have more information, you did an update on your PDSA, and now you've got a more upgraded version to kind of make more thoughtful, actionable goals moving forward. And then sometimes you do PDSA 3.0 because you learned more from your 2.0 version and where we're at today. So always knowing that it's a cyclical time and that more time you spent on this, the more PDSAs you do over time, the more improvement that you'll see to make sure that you've sustained the overall gains. And it's always nice to do a PDSA that reviews back to say, has the gains that we've been making sustainable now? And we've learned that the individuals in the services that we're providing have found that this new method is the best method and what works for us. So I want you to start your PDSA 1.0. You already started part of it in our robust brainstorming conversation today. And I want you to start checking in back at your agencies, your organizations, and your counties to start thinking about who you can start recruiting as thought partners and who can be part of your PDSA monitoring team. Again, you can make this as formal as creating a work group and having your PDSA work group. You can make this as part of your team meetings that happen once a week, once a month, as a place to kind of invite that, but have a place that has dedicated time and energy spent into reviewing how are we engaging family and youth voices in looking at our crisis continuum, our care, how we provide services, are they the best services, as well as if our services are helpful, how are people experiencing these services through the lens of other providers that are interconnected to our work. We heard examples of paramedics and other kind of EMS individuals may have had a different experience with them. So what's the role that you as a provider have to advocate and influence and elevate the voices of your youth and families with others? And that could be a really helpful to say, what's our PDSA action number one? What's our first step? Do you do panels? Do you have feedback? Do you have spaces like that to already solicit that? That might be your first PDSA there. We recruit using brochures, but we now heard that brochures might not be read. So maybe we're gonna upgrade our brochure to a QR code. And where are those great places to add a QR code in different environments where people are going to use them and utilize them and feel comfortable? So those are really great places to start your first step. Now, I'm gonna tell you, all of you who came here are change makers. You are someone who said, I want to come, I want to learn, I want to see what people are doing. And you are all taking creative action to solve a problem and support the community. So I don't want you to think about this PDSA is something that some scientist only does. You do it on an everyday basis. And so I want you to think about that more of a guide and to support you in what your PDSA looks like. If the questions don't fit for you, update the questions. They're really intended to give you a tool and a support and a structure that might also facilitate other robust brainstorming conversations, but use it to really just monitor change overall and do process updates. Now, that leads us into our next training that we'll have in the Learning Collaborative, where we're going to talk about some examples of best practices for continuity of care along the crisis continuum. So again, your PDSA will feed into kind of coming back next time where we're going to talk about more of those examples. So it's a great way to start that process, start putting it into action, start creating your template and see where you're going from there. And then next week, next month, you'll have more examples that you'll be able to feed into your PDSA.
Thank you. We hope you'll join us at upcoming learning events, and we will be in good contact with you in email world. Thanks, everyone. Have a great day.